Three syndromes that cause neck pain. The first one is postural syndrome. This is the one that affects most people. We're going to go through this in most detail. Postural syndrome gives you pain after about 20 minutes of doing the aggravating activity, which may be just sitting in a bad posture, standing, or whatever work that you're doing. But the important difference is dysfunction syndrome gives you immediate pain once you move into the aggravating position. That is how you differentiate those two. The third type is derangement syndrome. Derangement syndrome is in relation to derangement of a spinal disc, so the disc between the joints, which is the most common cause of lower back pain, but not the most common cause of neck pain. When it comes to the neck, we are mostly concerned with postural syndrome. Now, the postural syndrome that affects the neck is called upper cross syndrome. There is lower cross syndrome, which affects the lower back, but upper cross syndrome is for the upper back. So we said it takes around 20 minutes for the symptoms to begin. And the important thing to know with this as well is the offset of symptoms occurs once you stop doing that aggravating activity. So if you're in a slouch position and you're getting pain, then with postural syndrome, if you go and lay down on the floor, within a couple of minutes you should feel relief from that problem. That is how you know you've got postural syndrome. Dysfunction syndrome is a little bit different because the pain is relieved as soon as you move out of the aggravating position, but you get the pain immediately when you move back in, and only at an end range when the joints compress against each other. The reason why we're differentiating the types of syndrome is because the treatment is different, both the in-office treatment and the self-treatment. A big part of postural syndrome includes postural education, so educating you and whoever's got the symptoms to do things that prevent the problem from occurring. We could take hours, going through your daily activities to work out all the different things that are causing your problem. But the best thing to know is once we tell you what the right posture is, in the standing, the seated, and the sleeping posture, that you will be able to assess yourself in all movements, in all activities that you're doing, so that you can sort of be self-medicating without medication, taking care of yourself.